hotspots, and no indication that he's feeling any urgency to make a plan.
It is very likely that by the end of tonight there will be 1,000 new deaths reported in the last 24 hours as well, just to give a sense of where people are at this moment. Professor Haseltine, the president did talk about testing. In the past, he has disparaged expanded testing, but today he said that if doctors and other professionals say we need more of it, then he will agree we need more of it. What do you make of that?
Well, first of all, I think I agree with everybody that it's a good thing that he finally said that we need masks, but it is far, far short of what we need. We need action. We need strategic plans. We need people helping the people in our southern and western states. We need people who can provide the equipment, and we don't have those plans. I'd like to see this resolve turned in to real action. You know, if you look at the number of deaths in the world, there's about 10 people dying every minute, and almost 2 of those are Americans. That is what is happening right now. Can we do something about it? Yes, but will it be in time for the decision that everybody is making right now? Parents are trying to decide whether to send their kids back to school. There won't be a vaccine or a drug by then. They have to make decisions on what we know now, and it doesn't look very good.
And will it be?
The people are out partying. The young people out partying. They have to decide whether to go back to college or if their college is going to be open. So we need action, and we need it fast, and we need it now. Actually, we needed it a long time ago.
Well, that was my
But
point.
now we need it.
We needed it months ago. We needed it months ago. It's too late by 142,000 deaths at this point already. Dr. Hotez, there is this matter of CDC data suggesting that the U.S. has 10 times more cases than is being reported. If that's true, what are the implications there? I mean, what does that mean for stopping the spread?
So we've known this for a long time, that the number of confirmed cases is just a fraction, and the scientists debate whether the real number is 3 times more, 5 times more, 10 times more. But that's right. I mean, we should assume that at least about 35 million Americans have been infected with COVID-19, and the numbers are continuing to climb. Well, what it means practically speaking is when we quote numbers like in Houston, where we've had 1,200 cases today or yesterday, what that really means is probably 5,000 or 6,000 cases. And the idea that we could do contact tracing of 5,000 or 6,000 cases in a day in Houston is, I don't see a path where we can do that. So today I put up, we published a paper really looking at a plan for the nation where we can bring the whole country back down to containment mode by October 1. Otherwise, we just can't do the contact tracing. I mean, the truth is, all the things we're talking about, masks and contact tracing, will work best when we bring it down to that low level, and then we can prevent the resurgence. And we can do that. We can do that by October if we have that national strategy. But it's frustrating that the federal government won't put that forward. Maybe the glimmer is that the president mentioned it today for the first time, and maybe it'll happen.
Professor Haseltine, I swear I thought of you the minute this happened. An executive from AstraZeneca told a congressional hearing today that if all goes well, they can have a vaccine ready to go, quote, from September onward. You are often very skeptical of claims and promises like this, so I've been wanting to ask you all day, what do you think of that?
Well, I think it's extremely optimistic. He's in a position, better than I am, to know what their results are. But I've been watching vaccine development, as Peter has, for many years. And we know that it's very difficult to assure the safety and the efficacy of vaccines. Even if a vaccine were approved September, it won't be in time for children to receive it. You just cannot do it in that time. And I can assure you, if a vaccine does receive emergency use authorization from the FDA, we won't know whether it's fully effective, and we certainly won't know if it's fully safe. So it is a very rash statement to have made, to give that kind of optimism when we know you have many barriers ahead of you.
Dr. Peter Hotez, Professor William Haseltine, we are both smarter and safer after speaking with you. Thank you so much for being with us tonight.